Well, welcome everybody. We'll be getting started, and as soon as Dr. Chaney, the professor, shows up here, he should be on any minute. And tonight we're going to be talking about nutritional support for cancer patients. And let me just introduce the professor before he gets here. Dr. Chaney is quite a renowned biochemist. He taught at the medical school of the University of North Carolina. I think, I should ask Suzanne, but I think it was close to 40 years, and he ran a very significant cancer research lab. And so he he straddles both of those worlds of, knowing the biochemistry of the medications in the medical world, as well as, it's the biochemists who discovered most of the vitamins and who really understand the intricacies of, cellular biochemistry and the role that nutrients play with it. So they're wonderful to help us, kind of bridge that gap of, prevention of disease and understanding the kind of the pattern of diseases and pathways of them and how they develop. And so that's why we're so grateful when he comes, because he also, when he was teaching, he received many awards for, where the students vote for their favorite teacher. And he received, a very prestigious award from the alumni of the Distinguished Professor Award. So we're very blessed to have him. And this is really his topic, and it's one that affects all of us. I don't know many people who don't know someone close to them who hasn't had to deal with this issue of cancer. So he'll help us wade through that and understand how what kinds of factors cause cancer, which he did a lecture about 6 weeks ago, I think it was, on cancer prevention, and he explained the progression of cancer, the 3 stages in which cancer progress. It was like, initiation, how a cell becomes cancerous, and then how that progresses to actually where it becomes full-blown cancer and it spreads. So tonight we're going to talk about when people are actually in treatment, understanding what's going on with that and how we can support that and what kind of nutrients would be helpful.
Such an important topic, Barb, because I think your comment is exactly right, that we all know people that are impacted by it. In my family in particular, that's one of the reasons why I was so passionate about taking the supplements first as a consumer before I even had an interest in doing the business, because we had so much disease in our family tree and a lot of different types of cancer, and I want to be able to prevent that. And so I so appreciate these talks and being able to know that, like you had said a few weeks ago, we can have cancer prevention information, but then people that haven't been able to stay away from it, we have a topic like tonight, which is so great and needed. So it's just very, very helpful.
You've already been introduced 42 times, so you can pretty much start. So let me just say thanks for joining us tonight, everybody. We're going to be talking about nutritional support for cancer patients with Dr. Steve Chaney, who is a renowned cancer researcher and now professor emeritus at the medical school at the University of North Carolina. And we are delighted to have him. So, Steve, I'm turning it over to you.
And I apologize for the delay tonight. Every once in a while you run into computer glitches, and mine decided to glitch just about 5 minutes before we were ready to go on. But let's go ahead and get started. So, if you're dealing with a cancer diagnosis, either for yourself or somebody in your family, that dreaded C word is a scary time. But I think, I probably should have started out this with myth number 1, because the myth that so many people immediately feel or think when they hear the cancer diagnosis is it's a death sentence. And that's really no longer true. But there's so many myths and not enough facts about cancer treatment. At the very least, it can cause undue stress, undue worrying, but sometimes it can hurt your overall recovery. The good news is that survival rates are improving. When I started in cancer research almost 40 years ago, there's some cancers that were incurable then that are curable now. There were some cancers for which you maybe only got a few years survival, where now you're getting 10 or 15 or 20 years survival. So the outlook is a lot rosier than it used to be, but we still have far too many cancers. The incidence of cancers, the cause of cancer, is not really decreasing. We're getting better at treating it, but we're not getting better at preventing it. So let's look a little bit just at the causes to begin with. So this is the myth number one that I actually put in the slides, and that's cancer is genetic. But the fact is that only about 5 to 10% of cancers are inherited. And by an inherited, I mean you've inherited a gene which really makes it almost impossible to avoid getting cancer. You're so heavily predisposed that you're going to get cancer one way or the other. So that's a very, very small percentage. But we need to also understand that there is a genetic component to a lot of cancers. There's sort of a genetic predisposition that alters our risk of cancer by changing the effects of our lifestyle choices. So you run into some people, maybe they smoke, they drink, they eat lots of red meat and processed meats, do all the wrong things, and they never get cancer. But other people just do a few things wrong and they come up with cancer. Maybe they have a perfect diet and they still develop cancer. So if you think about genetic predisposition, I think the best way of thinking about that is genetic predisposition puts the bullet in the gun, but you still have to pull the trigger. We pull our trigger by our lifestyle choices, and this is the much more common cause of cancer. So that's myth number one. But myth number two, and again, it sort of goes along with the myth that many people have that cancer is genetic, and they think they can't do anything to prevent it. But in fact, the American Cancer Society tells us that 60% of cancer deaths are preventable. 30% of them are caused by tobacco use, and another 30% are poor nutrition, physical inactivity, overweight, and obesity, basically lifestyle factors. Now, you hear all of that information, that it's not necessarily genetically caused, it's lifestyle, it's avoidable, it's preventable. So I think it's really important to know that cancer, the myth it's a myth that cancer is your fault. You shouldn't blame yourself. The fact is you can never know. There are genetic, environmental, and stress factors that all contribute to cancer. And for most of us, these factors are either unknown or they may be unavoidable. So give up the guilt. I love that picture of the puppy. He probably left a deposit somewhere else on that beautiful rug. For those of us who have puppies, we understand that. But, you want to give up the guilt because it will really interfere with your ability to recover. One of the things I'm going to talk about later on is a positive outlook. A belief that you can and will recover is one of your most important assets. So now we're getting into, you've got cancer, you're talking with maybe your oncologist, but more likely a good friend, somebody who considers themselves an expert, and they'll say, don't take vitamins, that's just going to feed the cancer cells. So for those of you that are old enough to remember the Vietnamese War, there was a famous story, as it were, about this village that was overrun with Viet Cong. They bombed it, and there was a lot of collateral damage. A lot of innocent villagers got killed. And when somebody asked the general later on, he said, well, it was necessary to destroy the village to save it.
Yeah.
And withholding nutritional supplements is kind of like destroying the village to save it. We're going to talk a lot about preserving normal tissue while we're undergoing chemotherapy. But you need those nutritional supplements to protect your normal tissue from the ravages of chemotherapy. Now, there might be a better strategy, and that's based on the fact that cancer cells only use glucose for an energy source. And they also require acidic conditions to metabolize those glucose, whereas normal healthy cells can use glucose, but they can also use any kind of carbohydrate, protein, or fat for energy, and they can thrive under less acidic conditions. So a better way might be to selectively starve the cancer cells by withholding glucose and simple carbohydrates and keeping the body alkaline. So if we go to the next slide, this is something that's called the Warburg hypothesis. Otto Warburg was one of the very early proponents, or actually one of the very early, he was in at the very beginning of us understanding human metabolism. And he hypothesized that cancer cells were fundamentally different because they relied on glucose and they required acidic conditions. So he hypothesized that if we could keep the blood sugar levels low and keep the blood alkaline, we might protect ourselves from cancer cells. So how would we do that? Well, we'd eat fewer sugars and high glycemic foods, the breads, the pastries, those sorts of things, and eat more low glycemic foods, vegetables, nuts, seeds, fruits, some whole grains. We keep the blood alkaline, and by that we eat less of the acid-forming foods like sugar, meat, cheese, eggs, and grains, and we eat more of the alkaline-forming foods like vegetables, nuts, and seeds, and fruits. Interesting, milk is okay, even though cheese isn't. And among the herbs, alfalfa is one that's valued for its alkalinizing effect. We also want to make sure that our normal cells are getting all the nutrients they need. So we want to eat a balanced diet with a lot of vegetables, nuts, seeds, and fruits, and consider supplementation to fill the gaps. And, you know, the Warburg hypothesis is exactly what it says. It's still a hypothesis. There's still debate among experts about how valid that is. And I'm certain nobody would say that you could use that one intervention alone, and that's going to cure cancer or that's going to prevent cancer. It's part of the answer. And I say not everybody believes it, but if you look at the recommendations that you need to follow, this is just a good, healthy diet. It's a plant-based diet, not eating a lot of sugars, not eating a lot of meats, and things that are not necessarily all that good for us. So, myth number 5 is vitamins are going to interfere with chemotherapeutic drugs. And the fact is there really aren't any clinical studies that have ever shown that supplements interfere with chemotherapy. But having said that, you know, it is a hypothesis, it is a possibility. And so I think it's, you know, it behooves us to, you know, to consider that possibility and then just to avoid it at all costs. So here's the important point. Most chemotherapeutic drugs are designed to leave the body rapidly after they do their job. And then because you've so damaged the normal cells during that short bout of chemotherapy, you need to allow time between chemo treatments for those normal cells to recover. So sometimes it can be a week, sometimes it's 3 weeks. Occasionally it's more often, but quite often you have a week to 3 weeks between chemo treatments. So to be cautious, just to make sure that the chemotherapeutic drugs and the nutrients aren't, the higher levels of nutrients aren't present in the blood at the same time, you could stop taking supplements a couple of days before chemotherapy and wait till a couple of days after before resuming. You know, that's one of the things that I often recommend that people discuss with their oncologist. You know, you can also, in terms of food-drug interactions, you can ask your pharmacist, or maybe just Google the drug and check out drug-food interactions at reliable sources like WebMD or RxList. But I really want to, but the other thing is that antioxidants, I mean, radiation therapy is different. Here you are deliberately trying to cause oxidative damage. So it's pretty clear that antioxidants would interfere with radiation therapy. And radiation is often given daily. You maybe give it every day for 5 days, a couple of days off, every another 5 days of radiation therapy. So you really need to avoid antioxidants throughout the entire radiation treatment. You don't want to protect those cancer cells from the radiation. But supplements that aren't antioxidants are generally okay during radiation. Now, let's talk about myth number 6. You can be your own doctor. You can be a cowboy if you want to call it that. You could just take these ideas and run with it, but I really don't recommend that. What I've done is given you a strategy to discuss with your oncologist. It's based on a scientific principle called pharmacokinetics. And I know that's a big word, but it's a
Yes.
word your doctor will recognize. So pharmacokinetics is really just describing the rate at which the drug enters the bloodstream and leaves the bloodstream, how long you have a therapeutic dose present in the bloodstream, factors like that. But there's a science behind pharmacokinetics, and the idea here is to use that science to prevent the nutrient and the drug from being present in the blood at the same time. So the idea is what you want to do is support normal cells between the doses of chemotherapeutic drugs without running the risk of interfering with the chemotherapy. So that's why you withhold them just in that window of time around the chemotherapeutic drug. But one of the reasons it's really important to discuss this with your doctor is there are caveats in this. There are some drugs that are cleared from the blood more slowly than others. Most of them are gone within a couple of days, but there's some that are cleared more slowly. And also, you need to exert some special care with herbal supplements because things, nutrients. Vitamin E is an antioxidant. Vitamin C is an antioxidant. I think everybody recognizes that, but when you start to get to herbal ingredients, some of them are antioxidants, and you may not realize it. One example of that is polyphenols. There are also some herbal ingredients that activate enzymes that affect drug metabolism. Some of the examples are St. John's wort, garlic, resveratrol, ginkgo biloba, ginseng. That doesn't mean that these are always going to be a problem when you're on chemotherapy, but certainly if you're using herbal supplements with those ingredients, you might want to have a conversation with your pharmacist just to see if there's any possibility that they would interfere.
Good suggestion on that.
So, myth number 7, that nutrition is unimportant during cancer treatment. I've had people say, well, nutrition didn't really cause the cancer, although that's probably not true. And nutrition isn't going to cure the cancer. Well, that's true. Nutrition alone will generally not cure the cancer. But what you're really trying to do is to protect the normal cells between rounds of chemotherapy. Because if you can do that, you're going to reduce the side effects. You're going to protect the immune system. I'm going to talk a lot about protecting the immune system in this little webinar here. But a healthy immune system is vitally important if you're trying to fight cancer. You also want to optimize the effectiveness of the chemotherapy. Now, that's another point that's often ignored, that actually that nutritional support doesn't just protect normal cells, but by doing that, you're optimizing the effectiveness of chemotherapy. So what does that mean? Well, with chemotherapy, you are trying to give multiple doses of the chemotherapeutic drug. It's often 6, 8, or 10 doses are ideal. If you can give a patient that many doses of the drug, the chances of wiping out the vast majority, if not all, of the cancer cells is very high. And if you've wiped out the vast majority of cancer cells and you haven't destroyed the immune system in the process, your immune system can wipe up those last few cancer cells. So you really want to be able to get as many rounds of chemotherapy in as possible. But whenever the patient becomes too weak, or if the white blood cells drop too low, then you have to stop the treatment because you're going to kill the patient. The chemotherapeutic drug would literally kill the patient. So the goal is to keep the patient as strong as possible during treatment so the full 6, 8, 10 rounds of chemotherapy can be administered. That's why you want to strengthen normal cells between chemo treatments. And that's another discussion to have with your doctor. Something that's not often thought about, but that's one of the things that I think is probably the strongest argument for nutritional support during chemotherapeutic treatment. So here's the myth about side effects, and that is that chemo only affects cancer cells. In fact, and the fact of the matter, chemotherapy non-selectively damages all rapidly growing cells. So it affects the hair, the lining of the digestive tract, the bone marrow, the immune system. It can cause skin lesions, sores in the mouth. It can cause problems with the digestive tract, leading to nausea, dehydration, those sorts of things. Now, there are two types of chemotherapeutic drugs. There's the classical ones, which are called the cytotoxics, and that description I gave you just a minute ago really applies with spades to the cytotoxic drugs. These are the ones that are toxic to cancer cells, but they're also toxic to a lot of normal cells. So digestive side effects from these drugs are nausea, vomiting, dehydration. You can get neurological damage. People kind of refer to that as chemo brain, but where your brain just doesn't seem to connect, doesn't function as well as it used to. It adversely affects the bone marrow. So it damages your platelets, your neutrophils, your lymphocytes, your red blood cells. We'll talk more about that in a minute, but that's going to affect blood clotting. It's going to affect your immune system. It can lead to anemia. So yes, I say your weakens immune system, can cause uncontrolled bleeding and so forth. Now there's a whole newer round of drugs. They're called biologics or targeted therapy. So that visual there is the cancer cell in the target of your gun sight. So the pros of those drugs are the side effects are less. They're much gentler, and normal cells are less effective. So that's really good. But there are drawbacks. The effectiveness of these newer drugs is often short-lived. Sometimes they only work for a few months, sometimes only a year or two. And they can be very expensive. They can cost tens of thousands of dollars, sometimes hundreds of thousands of dollars for a full round of therapy. And even with the best insurance in the world, not all of that's going to be covered. And because of the fact that their effect is often short-lived, they are still often used in combination with the cytotoxic drugs. So we're getting some reduction in all those side effects we've talked about, but it's very seldom that we avoid those entirely. So let's talk about coping with some of those and how nutrition can play a role. Let's look at nausea, for example. Herbs, herbal teas with ginger or peppermint or chamomile. Those often help with nausea. For dehydration, electrolyte rehydration drinks are great. There's so many of them in the marketplace, but you want to avoid the ones that have artificial sweeteners and colors and that sort of things. You also want to avoid the ones with excess sugar. Look for ones with a blend of carbohydrates, some sugar, but also more slowly released carbohydrates. There's another point that I've made in this particular thing, and that is sometimes these rehydration drinks or rehydration reduces the side effects of chemotherapeutic drugs. More so for some than for others. If you look at that graphic in the lower right-hand corner, there are some drugs for which it's so well established that rehydration is important that rehydration is actually given by vein while the patients are on the chemotherapeutic drug, because it's so important in reducing the side effects. But there are a lot of others for which that just a rehydration drink while you're undergoing the chemotherapy can be beneficial. And Barbara, I think you told me you've certainly talked to people with that experience, right?
Yeah, and they've just said they've felt pretty good when they have finished their therapy and the infusions. So big difference. No headaches, no nausea, no, and just felt more energy.
So that again, that's another thing to discuss with your oncologist, because it's something that in most cases isn't going to interfere with the chemotherapy and may make the side effects less. We talked about the fact that a lot of these cytotoxic chemotherapeutic drugs affect the lining of the stomach, affect the lining of the intestine. So you have digestive issues as well. Here's where things like probiotics and digestive enzymes can be helpful. So, this is one of the things that is fairly common with chemotherapy, and that is because of the nausea and also your taste sensation changes. I've had a lot of people who
I've heard that a lot.
Yeah, chemotherapy, they say everything tastes metallic, everything tastes bad. And so when that happens, it's hard for people to eat regular foods. Foods they used to love and eat all the time taste terrible to them. And it becomes difficult to get the protein and calories they need. And this is where protein smoothies can often be useful. Again, you want to choose the ones without the artificial sweeteners, flavors, and colors. You don't want too much sugar, but you want enough sugar so that they're providing good blend of calories and protein. So a 1-to-1 ratio of protein to carbohydrate is about optimal. But here's an interesting thought, because I think we get so hung up sometime in what we know about optimal nutrition and preventing cancer that we think we should be really, really rigid in, what this protein shake would look like or what this protein smoothie would look like. And one of the things just about any dietitian would tell you that taste is more important than nutrition rules. If you have to put some ice cream in there to get your cancer patient to take the drink, you do it because of, the protein and calorie intake is essential. You tend to lose weight and lose muscle mass with cancer anyway. It's a reaction to the cancer itself, and you don't want to be having inadequate protein and calories on top of that. So myth number 9 is cancer cells are ignored by the immune system. And actually, that's not true. The immune system can be an important ally in fighting the cancer. Obviously, the fact that the cancer developed means that the immune system became overwhelmed. But as you start to be successful with the chemotherapeutic treatment and you decrease the cancer burden, if you keep your immune system strong, it can start to play its role again in fighting the cancer. So that's why we talk about, we really don't want to weaken the immune system. We don't want to lose white blood cells. So that's what this slide is all about.
I see.
So the bone marrow is one of the areas of really big concern. That's the reservoir for what we call undifferentiated stem cells. That's a fancy word for precursor cells for all of the cells that we find in the bloodstream. That includes the platelets, which are needed for clotting, the neutrophils and lymphocytes, which are needed for the immune system, and the red cells, which carry oxygen. And it's important that that bone marrow has to constantly replenish those cells because blood cells have a relatively short lifespan. Depending on the kind of blood cell, it lasts from a few weeks to a few months. They need constant replenishing. We need to keep that bone marrow healthy. And this graphic here just shows you what happens with a healthy bone marrow. You see all of those cells being produced by the bone marrow. But after chemotherapeutic treatment, if we haven't protected the bone marrow, it's much less able to produce the cells that the bloodstream needs. That's because the conversion from stem cells to mature cells requires cell division. And you're blocking cell division with the chemotherapeutic drugs. So we need to provide the nutrients the bone marrow needs to replenish red cells, white cells, and platelets. So let's talk about that. What happens if your immune system becomes too weak? This gets back to what I was saying earlier about we had to destroy the village to save.
Yeah.
Because sometimes we see that, this is not me personally, but oncologists I've worked with over the years, you start out and you think you're having great success, the tumor's responding, but all of a sudden the white cells get too low and the patient dies from a fungus infection or a bacteria or yeast infection that rapidly spreads throughout their entire bloodstream because they no longer have an immune system to fight it off. Or they can get internal bleeding or stroke from loss of platelets because their blood isn't clotting. And although it's less life-threatening, they can suffer from anemia and lack of energy from loss of red cells. Just that tiredness, that constant tiredness that many people feel during chemotherapy is something that can often be avoided. So you want to make sure that your immune system is getting the nutrients it needs. And I can go through this fairly rapidly. Just if you think about this, these are nutrients that every healthy cell needs. But your immune system needs B vitamins because those immune cells need to divide rapidly. When there is an invader, whether it's a virus or bacteria, or even a cancer cell, as soon as one immune cell senses that, it immediately signals for thousands or millions of immune cells to be developed as rapidly as possible so they can inactivate the invaders. Antioxidants, that's because immune cells create lots of free radicals. That's important in how they do their job, but you also need to protect the immune cells from the damaging effect of the free radicals. Trace minerals, especially iron and zinc, are required by important enzymes in the immune system. Vitamin A, and I'm not talking about just the preformed vitamin A. A lot of this should come from carotenoids, which you get from the dark green, leafy, and red and orange vegetables. These are needed for differentiation of the immune cells and to prevent bacteria from actually entering the body. They make the skin so that it's less likely, more protective. Vitamin D, because resistance to cold and flu correlates with vitamin D levels. Protein, you need a high-quality protein. Omega-3 fatty acids, I'm going to come back and talk a little bit about that in a minute. But here's the deal. We don't need mega doses of these. We just need to make sure that we're getting enough. And we don't necessarily need lots of individual supplements. We just need to make sure we're covering our bases. So what about other normal tissue? Well, as I said earlier, that same nutrition program is ideal for most normal tissue. Platelets need vitamin K. That little picture there is a blood clot. The activated platelets are the white cells that you see there. The red cells are also part of the blood clot. But the platelets play a very important role in forming and allowing the blood to clot when it's needed, and that requires vitamin K. Red blood cells need iron and B vitamins. So they need all those other nutrients we talked about, but especially high need for iron and B vitamins. Platelets need all the other nutrients, but especially high need for vitamin K. So what should your nutrition program look like? We start with a healthy diet. That would be the USDA food guide recommendations, a plant-based diet with lots of fresh fruits, veggies, seeds, and nuts. Moderate levels of healthy carbohydrates, healthy fats, and healthy protein. And I always recommend a basic supplement program to make sure you've covered your bases. Now, one of the things we should talk a little bit about is bad fats versus healthy fats. Now, I realize this is more in the prevention of cancer than for a patient who already has cancer. But, and again, if you think about some of the effects of these fats, we really want to really see how important it is. So the bad fats are shown there, a lot of the vegetable oils, the red meats. Chicken and turkey are actually okay if you trim away the fat. You want to avoid the red meats, the processed meats. Healthy fats are things like salmon, the eggs, the nuts, the seeds, olives and olive oil, avocados. Those are healthy fats. But to put that in perspective, let's talk about eicosanoids and why they're important. They're hormone-like substances that control cell growth. And, the good eicosanoids do all the things in the left column, but perhaps most important is they decrease cell division. When you think about it, one of the hallmarks of cancer cells is uncontrolled cell division. So if you can decrease cell division, you're decreasing the likelihood that cancer cells are going to proliferate. The good eicosanoids also enhance the immune system. And we've talked quite a bit about how important the immune system is. The bad eicosanoids increase cell division, so it stimulates the growth of cancer cells, and they depress the immune system. So where do these come from, these good and bad eicosanoids? Well, the omega-3s are the good eicosanoids are made from the omega-3s, particularly omega-3s in fish. Now, these are the long-chain omega-3s. These are the ones that are most efficiently converted to those good eicosanoids. You can get omega-3s from flaxseed, canola oil, seeds like nuts, nuts like walnuts. Those are all good sources of omega-3s, and they're good for you. They're shorter chain, so they're not as efficiently converted to the good eicosanoids, but they're still valuable. But we need those extra omega-3s to counteract the bad eicosanoids that are so prevalent in our diet, because the omega-3 fatty acids produce good eicosanoids that inhibit cancer growth. Omega-6 fatty acids, which we find in vegetable oils and some of those other bad fat sources, stimulate cancer growth. Saturated fats and trans fats may also stimulate cancer growth. So this is where we talk about the good fats, bad fats.
And Steve, I might point out, this is a real issue for Americans because we eat so many processed foods that come out of bags and boxes, and like chips and snack foods often have those oils on them, right?
Right, absolutely.
The bad oils, and so we don't. They're crunchy and they taste good, but that's the stuff that we need to eliminate. That's why when you go to the real foods, the cucumbers and grapes and then just natural foods for snacking, it's so much healthier.
Absolutely. I love that good fats, bad fats graphics we had a few slides ago. But it really is getting to know what are the healthy fats and what are the bad fats, and making better choices for most people. We also want to protect our liver during chemotherapy. Chemotherapy drugs are essentially poisons. They're cytotoxic compounds. By the way, that means they kill cells. That's what cytotoxic means. So they need to be inactivated by the liver as soon as possible. You want them to kill as many cancer cells as possible. Then you want to get rid of them so you don't also kill normal cells. And so the liver is working extra hard to inactivate these poisons, and it's often damaged in the process. So certain herbs that help to cleanse and protect the liver. Herbs like milk thistle, dandelion, turmeric, artichoke, schisandra, those are some of the most popular ones if you read in herbal journals and that sort of thing. You'll find those listed. So let's talk about, we're just about closing out here, pros and cons of chemotherapy. There is a controversy here because many experts in the field feel that chemotherapy is overprescribed. And sort of the rationale here is, why put patients through the agony, that would be the side effects, and the expense of chemotherapy? Sometimes you exhaust your insurance and then you're using up your life savings if the effect of chemotherapy on survival is minimal. So there's some cases in which the effect of chemotherapy on survival is minimal, but it's still being recommended with all those, so this is some experts feel it's overprescribed. But on the other hand, the last thing a doctor wants to take away from a patient, particularly a cancer patient, is hope. Because a positive mental outlook is a cancer patient's best ally. So you can appreciate the oncologist is really on the horns of a dilemma here. They don't want to take away hope, but they don't want to offer false hope when survival is going to be minimal. It's really a very, very difficult problem for them. So if you want to learn more about the drugs, because your oncologist may not share this information with you because he or she doesn't want to take away hope. But here's some terms you need to know. Partial remission means that tumors have stopped growing or are shrinking. Complete remission means the cancer is no longer detectable. Oh, and that last one is supposed to read cure. And that means the cancer is not detectable for 5 years or more. So you see, there's a difference between remission and cure. Remission means we can't see the cancer right now. Cure means it's been gone for 5 years or more. So when you hear your doctor talk about remission, it's not the same as cure. So questions you might want to ask your oncologist when they're recommending a course of treatment. What percentage of patients experience complete remission? What's the duration of the remission? What's the 5-year cure rate? What are the side effects? What's the cost? But here's the important thing. Only ask those questions if you really want to know the answer. Because if the answer is not what you wanted to hear, do you want to know that? Can you handle that? So those are questions to ask if you really want to, get the absolute truth from your doctor, but you don't always want to know the truth. So, my final thoughts. Chemotherapy is the best of times and the worst of times. That's a quote from Dickinson. I think you may recognize that. At its best, it offers miraculous cures. At its worst, it exerts a terrible toll on the normal cells of our body. So a prudent approach is to support our normal cells while minimizing the interference with the chemotherapy. If we do that, there's a possibility of minimizing the side effects and improving the quality of life and maximizing the number of chemotherapy treatments that can be given. So thank you for joining me.
And I just want to say, as we're closing this out, that cancer treatments have come a long way, baby, right?
Yes, they have.
And that
I shared that at sort of the very beginning of the advances I've seen in my 40-year career in the field are absolutely amazing.
Yeah, it's and that's what I think we all want to understand is that these therapies often buy us time because the research is progressing. And gosh, what is it now for breast cancer? It's a very, very high remission and recovery rate. So what is it, Steve? Do you know? It's like
I don't remember the actual rates, but I can tell you it's amazingly different than it was when I started and when I started years ago. And nowadays, it used to be that with breast cancer, it almost always came back. Now, it still comes back sometimes, but not nearly as often as it used to. In many cases, we really are talking about cures, which we almost never saw when I started my career.
And what's interesting is what we were mentioning when we were trying to get your computer going at the beginning of the of the webinar, is that Suzanne and I recently heard Dr. Dean Ornish, and he really presented some very compelling new studies that really showed how effective lifestyle is on all kinds of diseases, including cancer. And he said, in many cases, more effective than drugs, because one of the things we want to mention here is just the power of being in a positive, loving environment, the power of reducing stress and learning how to manage stress and to be more calm about our life and less anxious about our life. Those things we don't, and exercise even. When you were talking about bone marrow, I was thinking, we think about bones and bone density, but really we want to be good to our bones because they are very important little manufacturing departments for all these very important, the red blood cells, the white blood cells, the platelets. That's where that all happens. We want to be good to our bones, and that's one of the things that exercise does, is it helps make healthy bones. So as the muscles push and pull against them. So it's just a wonderful reminder of how we can be proactive in general, but especially to be really good to our bodies when it's fighting serious illnesses. So this was excellent. Thanks so much. To our next webinar, which is on building healthy cells with nutrition and supplementation, with Dr. Steve Chaney, Professor Emeritus of the Medical School at the University of North Carolina, and myself, Barbara Lagoni. And we're going to be reviewing some of the products and diet that really can be very effective for us in building healthy cells. So, Steve, let's begin with a quote from Dr. Shackley, who said, "The medical field is interested in treating disease. I'm interested in building health." And I think that's a great place to start, because for all of us, that's what we want to be about. That's what we want our focus to be. And so we want to begin, we're going to talk about a couple of different collections of products here, and we want to begin with products that address digestive issues. So there's some wonderful Shackley products, and I just want to say at the outset that one of the things that attracted health professionals like you, Steve, and myself and others is how remarkable it is to find a company like Shackley that is so obsessive about quality, about potency, and about purity. And as we learn more about the diminishing standards in the industry for vitamins and herbal supplements, we understand how really rare and important this is in our world today. And so well, especially when we talk about herbal products, that the care that has to go into the number of tests to test whether you have the proper species of a plant is really quite critical. And so we want to begin by talking about products that can be very, very beneficial for digestive issues. And stomach soothing complex is the first one we want to mention. This is wonderful for people who have nausea, or even people who get motion sickness, and it's just such a wonderful, soothing herbal product. You can swallow the tablets, but they're made of peppermint and ginger. You just drop 2 tablets in a mug of hot water, and you just have just even breathing it is very soothing and quite delicious. And then one of the most important products that Shackley makes is a very high quality hydration drink mix called Performance. It was developed originally for elite athletes because it is designed to leave the stomach in seconds. But what we have learned over time is that it's wonderful for anybody who is having digestive issues, because hydration is so critical in when someone, you get dehydrated from vomiting, from diarrhea, from heat and perspiration and so on. And this is really, it's so critical for the body. And this gets in the bloodstream very, very quickly and rehydrates. I'll show you a slide on it in more detail in a minute. And then I think probably one of the most important products of all the Shackley line is their remarkable probiotic system, especially this Optiflora capsule, which is encased in 3 layers around it to protect it as it passes through the stomach acids. This is very unusual. It has 90% of most probiotics are completely destroyed by the time they pass through the stomach. Oh, I see the 70% fell off. Oh, it's probably behind that performance can. Anyway, it should be 70% of the immune system is in the gut. And we're learning more and more about that. So if you want to have a strong immune system, whatever you're dealing with, that's the first place I go is first you keep the gut healthy, and that's where probiotics come in. And then the fourth one is EasyJust. This is a remarkable, comprehensive digestive enzyme product. People who experience heartburn and indigestion and any kind of issues where their stomach and intestines are being taxed. This is their pancreas is supposed to be making digestive enzymes, but sometimes those organs are being taxed, and so EasyJust is phenomenal. There are so many products on the market that are, blocking acids in the stomach that really concern me, and I always recommend to people first give the body what it naturally needs to break food down and help it digest properly so you can absorb the nutrients from it. And that's what EasyJust does. It's almost instantaneous, the relief people get.
So, this just tells what it does. It minimizes fluid loss, maintains blood sugar levels, increase endurance. But in this context, that's not the most important thing. If we go to the next slide, I think the most important thing is how it's designed. It's designed for sustained energy and it doesn't have any artificial sweeteners. So what does that mean? It means that you don't have any artificial sweeteners. We certainly wouldn't want those, but you don't also have a lot of sugar in it. It's a mixture of carbohydrates, so some sugar, so it'll be used right away, but also it has more complex carbohydrates that are utilized slowly by the body. So that's what gives you the sustained energy, but it also means that it doesn't have either the artificial sweeteners or the sugar overloads that a lot of the other products out there provide. Also, a lot of the products only provide a couple of electrolytes, but Shaklee, through their work with the NASA for the space science, space system, they found that you really need 6 electrolytes, not just sodium, potassium, but you also had calcium and magnesium and other electrolytes with that. You get a much better electrolyte balance. And, there's nothing artificial, nothing synthetic in there. It is so much better than most of the competition that you find out there.
And it's not blue. Good. There are certain nutrients that are critical for the health of our immune system in general, for areas of the immune system is not like one place. There's many parts of the body. It's just fascinating to learn about the immune system and how intricate it is and how nature has developed all these wonderful ways to help protect us. And one of the areas is our bone marrow, which needs to build the white blood cells, the red blood cells, the platelets, and that requires protein, high quality, readily digested protein. And so those are very important. This is where I love the Shaklee Life Shakes and the energizing soy protein. And you want to look for every way you can to tuck protein into your diet, in not only around the meals, but around the snacks, around the drinks. And what's lovely about these protein shakes is they're delicious, they taste really good, and they're packed with like 24 grams of protein and 6 grams of fiber. So they're very nourishing, and they're very, very important for keeping the immune system up, especially if your body is fighting serious conditions. And then for healthy bone marrow, you need lots of things. You need vitamin C and E and zinc, all the immune nutrients. You need B complex and the carotenoids, which are the things that give color to dark green vegetables and orange and red vegetables. Vitally, the multivitamin is just excellent. And what's great now is all of those nutrients, 80 of them, are in that vitalizer, which is over to the side there. And often if people need extra iron, which we often do when we're fighting health conditions, it comes as one of the options. So you can have it with 18 milligrams of iron in it. And then there is this remarkable product, the Nutriferon, that was developed by the immunologist who discovered interferon, a very important key component of our immune system. And it's comprised of 4 natural herbal extracts, and all of which are safe and natural, but when they come together in this particular formula, it becomes very effective at stimulating the body's own natural production of interferon. It's a really phenomenal product. There's a little bit more about vitalizers. Steve, you want to talk about this a little bit? Because this gets into the delivery system.
Well, I think you've got a slide, and I think the next slide really goes into the delivery system, but you've got 4 different delivery systems. Yeah, so this one,
Try
there
clicking.
you go. I always enjoy that. 4 different delivery systems so that all the nutrients get to the right place at the right time. I think that's something that other companies don't have. So you've got the 80 nutrients, but you've got the different delivery systems, so they're all optimally utilized.
Because some have to be absorbed in the stomach, and others in the small intestine, and some in the large intestine. I mean, that's what's so brilliant about it. That's why there's 12 patents on it. That's why there's 12 clinical studies on it. That's a remarkable product. And look at all the different areas of the body that it contributes to. That's why if you're starting somebody on just basic stuff, when you give them that vitalizer, you know that they're going to feel better because of all these areas that it improves. It's a great product. Okay, let's go to the next slide, Becky, and there's Nutriferon. We want to mention here, again, 3 exclusive patents, 4 human clinical studies, 40 years of research behind this. This is a remarkable product. Anything else, Steve, on that guy?
No, but I think this is the one that if you're concerned about your immune system, you want to keep your immune system operating in tip-top shape, you want to be using Nutriferon on a regular basis. It's also, sometimes I think of it as a normalizer of the immune system. So not only does it help strengthen your immune system when your immune system is under attack, but when your immune system becomes overactive, it also helps to calm it down. So it's more of a regulator than just something that we would think of as blindly stimulating the immune system. It's really a remarkable product.
Mm-hmm. It's a remarkable product. Okay, now nutrients for platelets and red blood cells, so critical. It's those red blood cells that are carrying the iron to the cells. And platelets are needed for clotting purposes, and they need vitamin K. And so we keep coming back to that vitalizer product because all these nutrients are present in that. But sometimes you want to take a little extra. I'm a big B-complex girl, and that's the one that turns every woman into Mother Teresa, but it also plays a very important role in healthy blood cells, in bone marrow, in helping prevent cravings for sweets and refined carbs, which are probably the worst thing in our diet, that cause all kinds of issues. And then if ever you know somebody who needs iron, normal iron levels are supposed to be between 12 and 15. When they drop below that, these prescription iron products are just awful. People hate them, and they hardly move the iron level. And this product is an old product. It's been around a long time in Shaklee, but it is fabulous. Nobody ever gets side effects from it, but boy, their iron levels, I know if I put them on that, it brings it up right away. It's a great product. It's very readily absorbed, which is always Shaklee's strong suit, is absorption. And so let's look at, this is really an important chart to pay attention to, because this is about the fats that we eat. And there are the good fats and there are the bad fats. And unfortunately, all the crunchy, chippy, salty stuff will fall under that bad fat category over there. And what we need is these wonderful, good eicosanoids, the omega-3 fatty acids that the body just loves. They help prevent blood clots caused by platelet aggregation. You know, as some of you heard Rusty Oast, the pharmacist who is with us about a month ago, and he always calls the omega-3 fatty acids and the Shaklee Omega Guard, he calls it a blood slicker because it makes the red blood cells more slippery. And that was one of the reasons that his heart surgeon told him that he survived these terrible 97 and 98, 99% blockages in his arteries, he said, was because he took rather large amounts of omega-3 fatty, of the Shaklee Omega Guard actually, causes dilation and opening up of the blood vessels so that blood flows more readily, but because they're natural anti-inflammatories, reduces pain and decreases cell division, very important, enhances the immune system, and improves the brain function because the brain's about 60% of those healthy fats. So the bad fats, those fried and crunchy vegetable oils that a lot of the processed foods come with, they do all the opposites, okay? Anything else, Steve, on this guy?
No, I think you've done a good job. I think the important thing to realize is, and this slide is not all inclusive. There's so many other things that the good eicosanoids do, which come from the good fats, particularly the omega-3 fats. There's so many good things that they do for the body that it's something that is very important that we make sure that we get a good balance of the omega-3s. Because there's so much of the bad fats that sneak up, as you pointed out earlier, just in the foods that we eat in our ordinary day-to-day life.
And those of us who have children understand that, these foods are marketed heavily to our kids and our teenagers, and we're really setting their bodies up for bad things when they eat just such tremendous amounts of them. And I just want to tell you, Shaklee Omega, fish oil products have become very trendy, but this is a really important product that Shaklee makes because it is so pure. They have this triple molecular distillation process, but it literally purifies it. So you don't have to deal with heavy metals of mercury and arsenic and cadmium, dioxins and PCBs. And because I'm telling you, we've even significantly reduced our fish consumption because I honestly don't know how you can guarantee clean fish. And in today's world, we've done a very bad job of polluting our waters, and unfortunately, our fish are one of the casualties of that. And so I take a lot of Omega Guard, but it's also in 500 milligrams or in Vitalizer, and the new Shaklee Life Strip now has 1,000 milligrams because it's been shown to be so important for health and prevention. So that's a great product. And then probably in all of our diets, one of the worst things that we eat are sugar and refined carbohydrates. And so learning how to begin to move away from those in our diet and putting in the healthy things, which is, vegetables, 6, 7, 8 vegetables a day would be so great. Every time I make stir fry or and cooking dinner, I always am looking for, 3, 4, 5, 6 vegetables that can be homemade soups, anything like that, so that we're making sure we're getting lots and lots of vegetables. When you look at your plate, you want about half of your plate to be vegetables. So one of the things that a vegetable-based, plant-based diet, and that's something Dr. Ornish talked about a lot, really underlined that, is that it makes the body more alkaline. And that makes the body more resistant to lots of diseases. And alkaline diets, I was reading 10 alkaline diet plan benefits, and they talked about mental and physical well-being and higher levels of energy, but they talked about the body is less prone to body aches and pains because a more acidic diet, which comes from sugars and animal-based foods, meats and dairy and greens and all that stuff, increases inflammation in the body, increases acidic acid in the body. They talk about reduced risks of cancer, less prone to diseases and illnesses in general, high nutrition to support a healthy lifestyle, overall good health and vitality. So it just, if you think about it, the most natural diet for a human body are the foods that nature gave us that grow naturally out of the earth. That's what we want to keep moving toward. In the meantime, that's why we have that wonderful alfalfa product. That is a great product. And that also helps alkalize the body. But just remember, when you take alfalfa, it's literally teeny little tablets of alfalfa leaves that have been dried in a very special way. So when you take alfalfa, always take 3, 4, 5 at a time. Okay, and then be aware that our liver is the filtering organ for the body, the filtering organ for the blood, and that's really important to periodically take care of the liver. And one of the products that is best for that is the Shaklee Liver DTX complex. That's milk thistle and schizandra and reishi mushroom. Wonderful formula and very, it increases bile flow. It's just an excellent product for helping to, love our liver. Oh, Steve, these are your slides. You want to talk about those?
We mistreat our livers in many ways. And we were talking medications here, but alcohol, when we eat too much fat and when we become overweight. What happens when we become overweight? You may have seen articles about it recently. We start storing fat in our liver, and our livers aren't meant to store fat. That damages our liver. Pesticides, food additives, all of these things that the liver has to get rid of damage the liver in the process. So, one of the things is to try and eat liver cleansing foods. And I just picked this one up off the internet. And I think there's nothing magical about these particular foods. I mean, we've got grapefruit in there. We've got green tea. We've got several different kinds of green leafy vegetables. Green leafy vegetables are great for that sort of thing. Turmeric, walnuts, avocado. I mean, these are all just healthy foods, but we can also add the liver DTX and the alfalfa.
Very nice.
And I think you covered this already. The liver DTX helps to cleanse the liver of toxic compounds. It stimulates bile flow. It reduces free radical damage. It's a great, and that's actually that picture up in the upper right-hand corner was milk thistle, in case you were wondering.
Oh, I thought it was pretty.
Okay. It is pretty.
Mm-hmm.
And then why alfalfa? Again, picture of the alfalfa plant in bloom. It's a natural diuretic. It tends to flush those toxins out into the urine. Chlorophyll. It provides chlorophyll, which has been known for many years to be a natural cleanser and detoxifier. And as you mentioned earlier, it increases alkalinity, helps to balance the body pH. Those are all very important functions.
When you take alfalfa also, you'll notice you'll never have bad breath and you won't have a lot of body odor either. It's a natural deodorizer besides. And that brings us to our summary slide. So to build healthy cells, a great starting place is that wonderful Vitalizer Daily Vitamin Strip with the 6 tablets on it that covers 80 nutrients. For cellular repair, we haven't talked a lot about this wonderful resveratrol polyphenol product called Vivix that the researchers talk about repairing damaged cells, reducing inflammation in cells. It's just a remarkable product. They're all the proteins, the life shakes, the energizing soy, meal shakes, physique, particularly good for keeping, repairing and rebuilding our muscles and keeping our muscle mass in good shape. Keeping our protein levels high, remember, is very critical for our immune system. And then Nutriferon, that remarkable immune boosting product, flavonoids and carotenoids. Those are those wonderful antioxidants. They're in that vitalizer, but you also can take them in addition separately. And they contain vitamin A, and vitamin A is one of the nutrients that controls cell growth. So with that will be a wrap. We'll thank everybody for joining us, and this webinar will be archived at betterhealthin31days.com. And we thank Dr. Chaney for joining us. This has just been loaded with great information. Thanks so much, everybody. And we will then see you next week. And next week, our topic is Lyme disease and Martha Wilmore. So we'll be understanding a little bit more about that condition. Thank you, Professor.
Thank you so much.
And thank you all for being patient while I was solving my computer issues.
Yeah.
We got it.
I love technology. I love technology. I love technology. Okay. Thanks, everyone. See you next week. Bye-bye.
Bye-bye.